problem with therapy is that it's stuck in the office. For the last 100 years, our methods may have changed, but the way we deliver them hasn't. You have your appointment and go home and live your life, hoping that something sticks when you need it most. But it's almost impossible for the therapist to understand what you are going through in your day-to-day life and when you need help most. But digital tools are changing all that. The Vira platform is really designed to help us overcome some of those limitations by taking the whole assessment and therapy process out of the office and into people's day-to-day lives. And we do that with a series of tools, including mobile phone apps, web platforms for practitioners and for healthcare systems. What the app does is it collects data continuously, things like sleep, physical activity, social connection, communication, mood, and it provides the person with insights on the patterns or the habits that shape their well-being and their mood, and use those insights to change them. The practitioner can then access that information and it gives them a deeper understanding of the person's day-to-day life. With that understanding, the practitioner can develop a personalised intervention. That plan can then be supported through continuous communication back out to the person from the practitioner. And this is what we call just-in-time intervention. They're notifications or nudges that arrive on your phone that give you support to follow through on the plans that you have to change your life in a more healthy way. The other big value of this platform is that it allows healthcare systems to learn how to be more effective very quickly. It's pulling data on how the people who access those services are doing, what's working for them, and also the different kinds of interventions that people are providing. And this way, the system can actually get a very clear picture of what's happening in their service and also, more importantly, what's working for each individual. This approach that we're using in Vira is part of a broader trend towards using digital tools to provide remote patient monitoring, access to virtual healthcare, and build a healthcare system that's much more responsive to the people who use it, rather than designed to serve the interests of the professionals who work in it.
Of course, when we collect this data, the security and privacy of the data is a major concern. At Ksana, we found that people are willing to share this data with us, but it comes with a requirement to manage that data responsibly. We collect data and give people back insights into patterns of behavior, and we also give tools for them to control who they share that information with.
With Vira, we're trying to be part of a transformation into a system that's much more accessible, that's much more effective, and that's much more personalised.